Hi and good evening. I am Dr. Eric J. Klein, a doctor of medicine. Today we are going to discuss the most commonly misunderstood medical term, the word acute. For a Filipino, when a doctor diagnosed their patient to have acute gastritis, they would interpret the word or the term acute as gravity of an illness or ibig sabihin malala at grabe na. So I made this medical video for everyone to understand the medical terms that are until now alien to most Filipinos. And I picked this one from the National Council on Aging. So what is the difference between acute and chronic illness? In the Philippine setup, acute for common Filipinos means grabe na ang sakit. But this is not what is meant by acute in medical language. Acute and chronic talks about timing of disease occurrence. Example, hours, days, weeks, month, year, and not about severity. Acute illness generally develops suddenly and lasts a short time, often only a few days or weeks. On the other hand, chronic conditions develop slowly and may worsen over an extended period of time, either months to years. What about the causes? Acute conditions are often caused by virus or an injury resulting from a fall or an automobile accident or by the misuse of drugs or medications. Again, the term acute or chronic has nothing to do with severity of illness, namely mild, moderate, and severe. So the term acute and chronic diseases means timing of disease and not severity. For example, a COVID develops acutely, but it can manifest itself in so many forms: asymptomatic, mild, moderate, or severe. On the other hand, for chronic conditions are often caused by unhealthy behavior that increase the risk of disease, such as poor nutrition, inadequate physical activity, overuse of alcohol, or smoking. Social, emotional, environmental, and genetic factors also play a role. As people age, they are more likely to develop one or more chronic conditions. What about symptoms and treatment? Acute diseases come on rapidly, mabilis, or in Visayan we say paspas kaayo, and are accompanied by distinct symptoms that require urgent or short-term care and get better once they get treated. For example, a broken bone that might result from a fall might be treated by a doctor and will heal in time. Sometimes, an acute illness such as the common cold, or we say trangkaso, will also go away on its own, especially if it's viral. Most people with acute illness will soon recover. If hospitalized for an acute illness, after your condition improves, you will likely be eager to return to the comfort and familiarity of home. But being discharged from the hospital doesn't mean you are fully recovered. On the other hand, chronic conditions are slower to develop as opposed to acute, which is fast or paspas. And chronic condition may progress over time and may have any number of warning signs or no signs at all, as in the case of asymptomatic development. Chronic and common chronic conditions are arthritis, Alzheimer's disease, diabetes, heart disease, high blood pressure, and chronic kidney disease. Unlike acute condition, chronic health conditions cannot be cured. They can only be controlled. Again, they cannot be cured, only that they can be controlled. Living with chronic illnesses or managing the symptoms of a chronic condition can often be done by creating a health care plan in partnership with your licensed physician. The plan may include taking medication, healthy eating, physical or occupational therapy, exercise, or complementary treatment. Frequently, chronic conditions can be prevented by practicing healthy lifestyle behaviors, such as staying physically active, maintaining a healthy weight and nutritional status, limiting sun exposures due to the possibility of cancer, and refraining from drugs, smoking, and excessive alcohol use. We all know that alcohol use can damage the liver in the long run, and smoking can also cause cancer, particularly lung cancer. Examples of acute and chronic medical conditions. For the acute medical conditions, we have asthma attack. They can develop from point of second to minutes. Broken bone, bronchitis, burn, COVID-19, common cold, flu, heart attack, pneumonia, respiratory infection, strep throat. On the other hand, chronic medical conditions include Alzheimer's disease, arthritis, chronic obstructive pulmonary disease or COPD, depression, diabetes, heart disease, high blood pressure, high cholesterol, obesity, osteoporosis, and stroke. Why self-management matters? If you are unsure about your condition, it is always safe to talk to your doctor about potential treatment options that can help you control your symptoms. Managing your health can save you symptoms from getting worse. Once again, I am Dr. Eric Chaiklin. Thank you for taking time in listening to these medical lectures. Thank you and God bless us all.